name is Murali Bhat. I'm a consultant hand surgeon, and this is Joanne White, who's our senior hand therapist. And in this video, we're going to tell you a little bit about what to expect with a carpal tunnel operation during and after the procedure. So I will talk a little bit about the operation itself, and Joe will talk to you a little bit about how to recover following this operation. So first of all, there are 3 treatments for carpal tunnel syndrome, and you will have had the first 2 non-operative techniques tried, including a splint and a steroid injection. These haven't worked for you, and surgery was proposed. And so there are 3 different types of approaches to the way the operation can be carried out. The first approach is to do an incision that is a long incision, about 4 centimeters or so long, which most people adopt. That's called an open carpal tunnel release. The second technique is endoscopic, where you have 2 small incisions made, one just at the wrist and one just at the palm, almost like keyhole incisions. And the third approach is when a small cut is made just in the palm to release the carpal tunnel. These operations are carried out under local anesthesia, and a lot of these operations are carried out every year, and we rarely ever do any other anesthetic, and the local anesthetic is very well tolerated by all our patients. Some surgeons use a tourniquet for the operation, and some don't during the procedure. As far as the stitches are concerned, some surgeons will use dissolvable stitches, and some will use non-dissolvable stitches. And these may be either visible to your eye or they may be invisible. So my technique is a small incision in the palm, which is called a mini open carpal tunnel release. And I use dissolvable stitches that remain invisible. Following this procedure, we bandage up patients. And from this point on, I'll ask Joe to talk to you about it. But before doing that, I wanted to cover a few things. The first thing is that the order of recovery of your symptoms needs to be appreciated. First of all, the only thing you'll see improving straight away after the operation is your pain, and particularly your night pain. Everything else, including some tingling, numbness, and some muscle weakness, will persist for a time after this operation, and that is completely normal. And there are 3 issues after the operation that I'd like to stress on. The first thing is that the scars for a carpal tunnel are very sensitive, and Joe will explain to you why that is. And your hand will be a bit weak to grip. And lastly, it's not uncommon for these cuts to open up a little bit during the healing period in the first 4 weeks, and that is perfectly all right. Having said all that, now I'm going to pass you over to Joe, who's going to tell you the most important part about how to recover from this operation and how to plan your life afterwards.
So I'm going to start by showing you a picture of the sensory homunculus. This diagram shows how much of your brain is dedicated to each body part. And what you'll see is that the hand is a very large part of the sensory homunculus. And this is because it's rich with nerves that interpret information from our environment. And it explains why, with any surgery or symptoms from carpal tunnel, have a big impact in our brains and to ourselves. So going back to your surgery, after surgery you'll be in a bulky bandage, which will look something like this. And it will stay in place for 5 to 14 days, depending on your surgeon's preference. What we ask you to do while the bandage is in place is to prioritise reducing swelling, which will help in turn to manage pain and promote tissue healing. One of the main things to do to help reduce swelling is to elevate the hand. So you want to aim to keep your hand above your elbow and above your heart, like this, or like this. Movement will also really help to reduce swelling. So you should span your fingers and thumb and then make a fist, and also touch your thumb to each fingertip and the base of your little finger 10 times every 2 hours until the fingers and thumb are moving freely. Patients often ask us about returning to activities, and it's really to be encouraged to use your hand, even whilst it's in the bandage, for normal day-to-day activities. For example, holding a pen, using a phone, getting dressed, using a knife and fork. All these things will actually help your hand in its recovery. Patients often ask us about returning to work, and it's different for different types of work. So if your work involves heavy lifting and gripping, it's likely to take longer to feel comfortable to do that because of the scar that's healing. Office-based work that doesn't require pressure through the palm, you're likely to be able to return to more quickly. You are best placed to know what your work tasks involve and whether you can return whilst following the advice in the initial stages. So once the bandages are removed, you can wash and dry your hands as normal. You will notice a scab over the wound, and once this has gone, it's important to start massaging your scar. Massage is really important as it helps to glide the tissues and prevent one of the possible complications of carpal tunnel syndrome, which is pillar pain. To do the massage, you should apply firm pressure in different directions all along the scar and around the edges of the scar for a couple of minutes, 3 to 4 times a day. As you apply that firm pressure, you should feel the skin and the tissue underneath moving. It's likely to feel sore and quite uncomfortable in the initial few weeks, but continuing it, as you continue it, it will gradually feel more comfortable, and you're not causing any damage to the healing tissues by completing the massage. Returning to activities such as sports can be done as soon as you feel comfortable when the bandages have been removed. That includes racket sports and contact sports. You can also return to swimming and getting the hand wet once the scab has removed.
Thank you, Joe. That was all very, very helpful. But I have a few questions.
Okay.
So the first one is, you asked me to massage the scar. Is there a particular cream you'd recommend?
So it doesn't matter the type of cream that you use. We do say if you've still got some slight open areas on your wound to avoid heavily perfumed creams, but any over-the-counter creams like any sort of emollient, E45, non-perfumed cream which isn't going to irritate your skin is absolutely fine. You can use Vaseline.
Okay. I have some of that at home.
Yeah, so usually people have some cream with that which isn't heavily perfumed in their medicine cabinet or around at home.
Then this thing about applying pressure, I'm a little bit confused. Can I put too much pressure or too little?
So it's not possible to damage any of the tissues or the healing nerve by applying pressure. So you can't apply too much. You should apply the amount of pressure that you're able to tolerate. So one guide that people will talk about is as you put pressure on the skin, your nail will blanch. That indicates that you are putting a reasonable amount of pressure. It's also important, as I was saying, to feel the skin and the tissues underneath moving. If you're just on the surface of the skin, you're not actually getting the underlying tissues to move. So it's no, you can't apply too much.
Yes.
You should tolerate a little bit of discomfort as you massage to the level that you're able to tolerate.
So some discomfort is good then?
Some discomfort is normal. It would be incorrect to say it will feel completely comfortable to massage a scar in the early days.
So a friend of mine had one of these operations, and she was telling me that the wound just opened up after 2 weeks or so, and the GP was worried about it and thought it was an infection. And then the surgeon wasn't convinced. What is this about the wound opening up?
So sometimes the edges of the wound, as the wound heals, it heals from the base of the wound and in towards the middle. And sometimes the very superficial layers of the skin slightly gap. And that's nothing to be concerned about. The only time you should be concerned about your wound is if your hand becomes suddenly a lot more swollen generally, or red, hot to touch. If you have a temperature, those are things that indicate that you might have a deep wound infection, and you should contact your GP or us in the hand unit if you notice those things. But otherwise, a little gapping at the superficial layers of the skin is
Oh, thank you,
fine.
because now I know my friend actually didn't have fever or any of that. Thank you very much. What about painkillers? Do I have to take lots of painkillers? What kind of painkillers?
So you don't have to take painkillers unless you are in pain, and some pain after surgery is normal. And we tend to find that standard over-the-counter medications such as paracetamol or ibuprofen are sufficient to manage your pain. If that isn't sufficient for you, then again contact the hand unit. It's also important to say that if you follow the movement advice, the elevation advice and the activity advice, that will actually help to reduce your pain level.
Thank you very much. Regarding sport, I'm a little unclear if if I didn't require to play some racket sport and it was something like football where I didn't need my hands so much, would I be able to start playing in a couple of weeks?
Yes is the answer. Whatever you're comfortable to do, even with your bandage on, is fine as long as in those first 5 to 14 days you're prioritising managing the swelling and any stiffness. You're not going to cause any damage by completing any type of sport, but we tend to find that people are uncomfortable to apply pressure in the palm. So running around and playing football once your swelling's resolved and your fingers are moving freely is fine if you're comfortable to do that.
And I think you answered most of my questions. I have just one last one. Hopefully this won't be necessary, but if something is not going exactly to plan, what can I do?
So if you are concerned about an infection, for example, you need to seek advice straight away. So contacting a walk-in centre, your GP, without delay. You can also contact us in the hand unit, and we'll put the details of how to get in touch with us up at the end of this video.
Thank you very much. Much appreciated.